Hello, this is Everyday ADD Coaching. Are you a woman and have you wondered if you might have ADHD? Let's find out. ADHD uniquely manifests in females. What do you think about this checklist? Let's have a look at it. Refrain from assuming that this will replace the advice of a trained expert or the results of official tests in a diagnostic evaluation. Is navigating stores, offices, and social events difficult for you? Is it hard for you to block out background noise and other things that other people find annoying? Are you unable to reach your objectives because of the amount of time, money, paper, or stuff you have? Do you sometimes feel attached? Do you regularly shut down midday? When others ask for one more thing, does it overwhelm you emotionally? Do you find yourself mostly coping, searching, playing catch-up, or covering up? Does it make you shy away from social situations? Do you feel embarrassed to host guests at your house anymore? Has this kept you from inviting them over? Is keeping track of your finances a challenge for you? Can you relate to the feeling of having little control over life and feeling overwhelmed by the expectations placed upon you? Is it as if you're stuck in a never-ending cycle of being either a tornado or a couch potato? Do you feel like you're always coming up with brilliant ideas, but can never seem to put them into motion? Do you feel dejected at the end of each day, despite your best intentions to get organized? Do you find it humiliating to see other people your age and level of education walk right by you? Is the prospect of realizing your dreams and potential a constant source of sadness? Has the lack of a thank you message or birthday card ever made you seem self-centered? Do you have no idea how other people keep their lives regular and consistent? Are you referred to as spacey or a slob? Are you trying to appear ordinary? Are you feeling like a fraud? Is managing everything so overwhelming that you barely have time to breathe, let alone enjoy life? Did anything stand out to you from this list? Post this here if you would. Do you want to learn more? Take a moment to like this and stay tuned. Finding out about this may change your life. Let me ask for a favor. Just hang on till the very end. I'd like to invite you to do something. It will not cost you anything and it will take moments to do. Please share in the comment what was the biggest barrier for you getting treatment. Women with attention deficit hyperactivity disorder are frequently misdiagnosed, undertreated, and ignored. ADHD isn't just a diagnosis for boys, although they are more frequently diagnosed with it. Why is this? Stereotypes are common. Clinicians often have referral bias, seeing ADHD as something entirely different. Women internalize their symptoms, normalizing them. Being a woman lends itself to role expectations. Women have more comorbidities or disorders which sit right beside ADHD. Hormonal fluctuations through the course of the lifespan all complicate the ADHD presentation in women. Traditional views on gender roles. Society's expectations of women make ADHD more complex in females. Women are expected to manage themselves, their families, and the home, which demands them to coordinate their executive functions consistently. Women with attention deficit hyperactivity disorder, ADHD, tend to struggle to meet these demands. However, in their pursuit of social approval, they are frequently committed to meeting these standards, and they usually do so by covering up their issues and symptoms. The complex relationship between social expectations and executive dysfunction in ADHD is fueled by shame and self-blame. When trying to make sense of attention deficit hyperactivity disorder, ADHD, Among female patients, therapists need to remember that many women base their sense of value and self-worth on how well they fit stereotypical gender roles. Attention deficit hyperactivity disorder in females. Social implications. When it comes to socializing, women with ADHD have it worse than males. Relationship obligations can be too much for women, so they may have fewer deep connections. Friendships are complicated for them to start and keep going strong. Embrace solitude to escape unease and bewilderment. They may experience distress in social interactions due to their heightened sensitivity to rejection, an extreme emotional reaction to actual or imagined rejection. When compared to women who do not have ADHD, they are more prone to participate in sexually dangerous behaviors. A possible explanation for this is that people learn to embrace their sexuality at a young age. Women with attention deficit hyperactivity disorder, ADHD, may engage in sexually risky behaviors, including beginning sexual activity at a young age, having several sexual partners, engaging in less protected sex, having more unexpected pregnancies, and more STDs. This can disrupt a woman's sense of self and cause an assortment of relationship problems. Women with attention deficit hyperactivity disorder. Extreme sensitivity. When comparing men and women with ADHD, hypersensitivities affecting the central nervous system are more common in the former. These can include sensitivity to commonplace stimuli such as touches, tags, sounds, lights, odors, and surfaces, as well as sensory overload. Physical symptoms such as headaches, migraines, gastrointestinal pains, queasy stomach, and trouble sleeping. Comorbid disorders with attention deficit hyperactivity disorder in females. Most women with ADHD also have another psychiatric diagnosis by the time they reach adulthood, which can make it more challenging to diagnose and manage the symptoms of ADHD. Anxiety disorders and problems with mood affect 25 to 40% of ADHD patients. Disordered eating, with bulimia being the most prevalent. Problems that manifest outside of the brain, such as conduct disorder, which is more commonly seen in females with impulsive type ADHD, or oppositional defiant disorder, also known as ODD. A female skewed disorder is borderline personality disorders. ADHD in women. How symptoms of inattention present. Many girls and women with ADHD may not cause apparent disruptions to others around them, but their symptoms are more subtle and include a higher probability of inattention. On the other hand, many medical professionals have seen only the hyperactive, disruptive forms of attention deficit hyperactivity disorder, or ADHD, in males. Externalizing symptoms like conduct difficulties and hyperactivity or impulsivity are strong indicators of diagnosis when compared to other presentations of ADHD, according to studies. Concealing symptoms. Studies reveal that women with ADHD are very driven to hide and adjust to their symptoms. In many cases, the noticeable symptoms are associated with anxiety or mood disorders, which might provide a false diagnosis. ADHD in women. The bias against women. Although it is not often deliberate, gender bias is ubiquitous and sneaky. It affects the way doctors classify women. There is a shortage of referrals for diagnosis or consultation for girls and teens with inattentive, non-disruptive symptoms because these symptoms seldom cause concern. Male behavioral symptoms continue to dominate ADHD rating scales. A lot of tools aren't validated for women's values and internalized problems, and symptoms never get any attention. ADHD in women, the role of hormones. Ovarian hormones are vital to a woman's mental, social, and physical well-being because of their wide-ranging effects on the body. Because estrogen protects the brain by increasing neurotransmitter activity, it influences the brain's ability to focus, pay attention, remember words, sleep, and concentrate. The manifestation of attention deficit hyperactivity disorder symptoms in females is influenced by estrogen levels, which vary monthly and throughout a person's life. Contrary to popular belief, the physical manifestations of attention deficit hyperactivity disorder, ADHD, can differ significantly from one woman to the next. ADHD symptoms differ with hormone variations. Worsening of ADHD symptoms is associated with a decline in estrogen levels. According to some women, it's as if they have an experience before they get treatment. After ovulation, estrogen levels drop, and they continue to fall until the beginning of menstruation. When progesterone levels are high and estrogen levels are low, symptoms are greatly intensified. Symptoms can also change from day to day because of this. The sensitivity of some women to these minute changes may be considerably higher. Around the time that girls start to show more signs of ADHD, throughout puberty, estrogen begins to work its magic. Anxiety and emotional instability are common symptoms of hormonal changes. However, they may also be at a peak during this time, leading to a wrong diagnosis of anxiety or a mood illness and inadequate or incorrect treatment. ADHD in women. Treatment needs to be different. The treatment options for attention deficit hyperactivity disorder, ADHD, include talk therapy, medication, behavioral modifications, and specific living arrangements. Here are some therapy options that women with ADHD should think about. A clinician or therapist experienced with ADHD in women and girls. Finding this professional is perhaps the most important and difficult thing. Be sure to ask about their experience treating ADHD in women. It's important for your support network to understand ADHD as well. Therapists can assist with reframing by validating your experiences, helping you examine how societal expectations shape your perspective, and teaching you how to advocate for yourself. Medication. Seek a physician who is well-versed in the complex relationship between hormones and attention deficit hyperactivity disorder, ADHD. In the second part of your menstrual cycle, for instance, you might not feel as much of an influence from stimulants. By increasing the amount of estrogen and progesterone that the body can use, hormone replacement treatment alleviates ADHD symptoms in women who have gone through menopause. Since SSRIs are frequently given for mood and anxiety disorders, it is crucial for physicians to comprehend how stimulants influence the overall impact of symptoms when taken with SSRIs. Professionals like therapists can teach you how to rearrange your mental and physical spaces to work better for you. Success with ADHD is within reach with the guidance of a coach, and finding a support group may do wonders for normalizing living with ADHD and alleviating feelings of loneliness, worry, and misery. So here's my ask. If you know any women who you suspect or they suspect might have ADHD, share this video. I enjoy this work because it can be life-changing for people. Wouldn't it be a great gift if you could be the catalyst for someone not unlike yourself to get the benefits you have experienced if you are treated for ADHD? This is Everyday ADD Coaching. Thank you for sharing your time watching this video. Take care.